Have you ever walked into a room and suddenly forgotten why you were there, or struggled to remember a familiar name only for it to come back a few minutes later? Most of us have experienced moments like these, especially as we get older. In many cases, they're simply a normal part of aging. But sometimes, subtle changes in memory or thinking can be early clues that deserve closer attention. Today's video is about those early dementia clues that many seniors don't realize could be important. Our goal isn't to cause fear. It's to help you understand the difference between common age-related forgetfulness and changes that may signal something more serious. The earlier these changes are recognized, the sooner a person can talk with a healthcare professional, identify possible causes, and, when appropriate, begin treatment or make lifestyle changes that may help. Some memory problems are caused by conditions that can be treated, such as medication side effects, vitamin deficiencies, thyroid problems, depression, or poor sleep. That's one reason it's so important not to ignore persistent changes. Stay with us until the end, because one of the final clues is often mistaken for just getting older, even though it may deserve a medical evaluation. Let's begin by understanding what dementia really is. Many people think dementia is a normal part of aging. It isn't. Dementia is a general term for a group of conditions that affect memory, thinking, reasoning, language, and the ability to carry out everyday activities. Alzheimer's disease is the most common cause, but there are several other types of dementia as well. Not everyone who becomes forgetful develops dementia. In fact, mild forgetfulness can happen to anyone. The key difference is whether the changes begin interfering with daily life. For example, forgetting where you left your reading glasses from time to time is common, but repeatedly forgetting how to use familiar household items or getting lost in places you've known for years is different and deserves attention. That's why recognizing the early clues matters. Let's look at the first one, repeatedly asking the same questions. Imagine you're talking with your father over breakfast. He asks what time the family dinner starts. You answer, 6 o'clock. A few minutes later, he asks the same question again. Then he asks it once more before lunch. At first, it may seem harmless. Everyone forgets things occasionally. But when someone repeatedly asks the same questions within a short period because they don't remember hearing the answer, it may be a sign that their short-term memory isn't working as well as it once did. Short-term memory helps us hold on to new information for a brief period. When this ability becomes impaired, conversations may begin repeating themselves without the person realizing it. Family members often notice this change before the person experiencing it does. If this happens once after a stressful day or poor night's sleep, it usually isn't a reason to panic. However, if it becomes frequent or continues for weeks or months, it's worth discussing with a healthcare professional. Now here's something important. Memory isn't the only thing that can change early on. In fact, the next clue often surprises families because it has more to do with planning than remembering. Let's talk about clue number 2, difficulty managing familiar tasks. Think about activities you've done for years. Paying monthly bills, following a favorite recipe, using the television remote, taking medications correctly. Most of these tasks become second nature over time, but early dementia may gradually make these familiar routines more difficult. Consider Susan, who is 71 years old. She has balanced the household budget for decades. Recently, she begins paying the same bill twice while forgetting others completely. She becomes confused by paperwork that once seemed simple. At first, her family assumes she's just distracted. Over time, however, they notice similar problems in other areas. She forgets the steps in recipes she's made for years. She has trouble organizing appointments. She struggles with tasks that previously required little effort. This happens because dementia can affect what's called executive function. That's simply the brain's ability to plan, organize, solve problems, and complete tasks in the correct order. These changes often appear gradually. They're easy to overlook at first. That's why paying attention to patterns is more helpful than focusing on a single mistake. Everyone has an off day. Persistent changes are different. Here's another clue many people miss. The person may become frustrated or embarrassed by these mistakes. Instead of asking for help, they may avoid activities they once enjoyed because they know something doesn't feel quite right. Approaching these situations with patience and kindness is much more helpful than criticism. No one chooses to have memory problems. As we continue, you'll discover an early clue that many families mistake for stubbornness or personality changes when it may actually involve the brain. Understanding that difference can completely change how you respond to a loved one. Before moving on, let's remember one important point. These clues do not automatically mean someone has dementia. Many medical conditions can affect memory and thinking, including dehydration, infections, certain medications, anxiety, depression, hearing loss, vitamin deficiencies, and sleep disorders. That's why a proper medical evaluation is so important. Never try to diagnose yourself or someone else based on a single symptom. Instead, look for ongoing changes that interfere with daily life and discuss them with a qualified healthcare professional. Recognizing these early clues isn't about expecting the worst. It's about giving yourself or someone you love the best chance to receive the right care, the right support, and the right answers as early as possible. In the next part, we'll explore additional early dementia clues that often appear before severe memory loss, including one subtle change in communication that many families overlook for months before realizing something more may be happening. Let's continue with another early clue that many families don't recognize right away: changes in language and conversation. Most people occasionally forget a word. You might point to the refrigerator and jokingly call it "that cold thing." A few moments later, the correct word comes back to you. That's a normal experience. Early dementia can be different. A person may frequently struggle to find common words, stop in the middle of a sentence, or replace familiar words with unusual ones. They may also have trouble following longer conversations or lose track of what they were trying to say. Imagine George, who is 74 years old. He has always loved telling stories about his childhood. Lately, however, his stories become difficult to follow. He pauses often, repeats the same ideas, or suddenly changes the subject because he can't remember the word he wanted. His family first thinks he's simply getting older. Over several months, they notice the changes becoming more frequent. Language is a complex skill that depends on several parts of the brain working together. When those areas begin to change, conversations may become more difficult. If someone occasionally forgets a word after a long day, there's usually no reason to worry. But if communication problems become persistent and begin affecting daily life, it's a good idea to seek medical advice. Now let's look at another clue that often surprises loved ones: getting confused about time or place. Have you ever forgotten what day of the week it was after a holiday? Most people have. Usually they figure it out within a few moments. Someone with early dementia may become confused about the date, the season, or even where they are. For example, they may believe they're living in a home they moved out of years ago, or they may become unsure how they arrived at a familiar location. Consider Mary, who is 76 years old. One afternoon, she drives to her local grocery store, a place she has visited hundreds of times. When she leaves the store, she suddenly isn't sure which direction to go home. She eventually recognizes a familiar street and gets back safely, but the experience leaves her shaken. Occasional confusion can happen to anyone, especially in an unfamiliar place. Repeated episodes in familiar surroundings deserve attention. This type of confusion isn't simply about memory. It may involve the brain's ability to process space, directions, and surroundings. Family members should avoid arguing or saying things like, "You should remember this." Instead, calm reassurance is often much more helpful. The next clue is one that families often mistake for stubbornness: changes in judgment and decision-making. Good judgment helps us make safe and sensible choices every day. As dementia develops, judgment may gradually become less reliable. A person who has always managed money carefully might suddenly give large amounts of money to scammers. Someone who always dressed appropriately for the weather may begin wearing heavy winter clothing on a hot summer day. Others may forget basic safety habits, such as turning off the stove or locking the front door. Let's look at another example. Robert receives a phone call from someone claiming to represent his bank. Without questioning the caller, he shares personal financial information. Years earlier, he would have recognized the scam immediately. This change isn't because he's careless. It may reflect changes in the brain's ability to recognize risk and make sound decisions. This is one reason older adults are often targeted by financial scams. Family members can help by discussing common scams, setting up fraud alerts when appropriate, and encouraging open conversations about unusual phone calls or emails. As we've seen so far, early dementia doesn't always begin with dramatic memory loss. Sometimes it first appears through subtle changes in language, navigation, or judgment. There's another clue, however, that many people completely misunderstand. It doesn't involve memory at all. It involves personality and social behavior. Imagine someone who has always enjoyed spending time with family and friends. Gradually, they begin declining invitations. They stop attending community events. They lose interest in hobbies they once loved. At first, this may seem like normal aging or simple tiredness. In some cases, It may be related to depression, hearing problems, physical illness, or another treatable condition. In other cases, it may be an early clue that changes in thinking or memory are making social situations more difficult. The person may avoid conversations because they're worried about forgetting names or losing track of what others are saying. Rather than assuming they're simply being unfriendly or withdrawn, it's worth asking gentle, supportive questions. Showing patience instead of frustration can make a tremendous difference. Remember, no single symptom confirms dementia. Healthcare professionals consider many factors, including medical history, physical examinations, cognitive testing, blood tests, and sometimes brain imaging, before reaching a diagnosis. That's why early evaluation is so valuable. It helps identify whether the cause is dementia or another condition that may be treatable. So far, we've explored repeated questions, difficulty with familiar tasks, language changes, confusion about time and place, poor judgment, and social withdrawal. But we're not finished yet. In the next part, we'll discuss several additional early dementia clues that are often overlooked, including mood and personality changes, why early diagnosis matters, and practical steps families can take to support a loved one with compassion while seeking appropriate medical care. Let's continue with another early dementia clue that many people mistake for stress, aging, or simply having a bad day. Noticeable changes in mood and personality. Everyone experiences mood changes from time to time. Feeling sad after bad news, becoming frustrated during a difficult day, or feeling anxious before an appointment is completely normal. With early dementia, however, personality changes may become more frequent and more noticeable. A person who has always been calm and patient may become unusually irritable. Someone who was once confident may suddenly seem anxious or fearful in familiar situations. Others may become suspicious without a clear reason, believing family members are hiding things or that someone has taken belongings that were simply misplaced. Imagine Linda, who is 72 years old. For most of her life, she enjoyed hosting family dinners and neighborhood gatherings. Recently, her daughter notices that Linda becomes upset over small changes in routine. If dinner is served a little later than expected or a familiar plan changes, she becomes unusually anxious. At first, everyone assumes she's just under stress, but over several months, these changes become more frequent and are accompanied by memory problems and difficulty managing daily tasks. This combination of symptoms encourages the family to schedule a medical evaluation. It's important to remember that mood changes alone do not mean someone has dementia. Depression, anxiety, medication side effects, chronic pain, thyroid disorders, infections, and many other health conditions can affect mood and behavior. That's why it's important to look at the whole picture rather than focusing on one symptom. Now let's discuss another clue that's easy to overlook: misplacing items and being unable to retrace steps. Everyone loses their keys or glasses once in a while. Usually, after thinking for a few minutes, you remember where you left them. Someone with early dementia may place objects in unusual locations and then be unable to retrace their steps. For example, a television remote might be found inside the refrigerator. Car keys may end up in a kitchen cabinet. A wallet could be placed inside a laundry basket. Even more concerning, the person may become convinced that someone has stolen the missing item. This isn't because they're being dishonest. They genuinely cannot remember where they placed it. Family members sometimes become frustrated and respond by saying, "You just had it." A calmer response is usually much more helpful. Helping the person look for the item without criticism can reduce stress and maintain trust. Now let's pause for an important reminder. Many older adults worry that every memory lapse means dementia. Fortunately, that's simply not true. Normal aging may involve taking a little longer to remember a name or occasionally forgetting why you entered a room. In many cases, the information comes back later. Dementia is different because the changes gradually interfere with everyday life. A person may forget entire conversations, repeatedly miss appointments despite reminders, struggle with familiar tasks, or become increasingly confused in situations they once handled easily. That's why healthcare professionals don't diagnose dementia based on one isolated symptom. Instead, they look for patterns that continue over time and affect independence. So, what should you do if you notice these early clues in yourself or someone you love? The first step is not to panic. Many medical conditions can cause memory and thinking problems that improve with proper treatment. Vitamin B12 deficiency, thyroid disease, medication side effects, hearing loss, depression, dehydration, infections, and poor sleep are just a few examples. Scheduling an appointment with a healthcare professional allows these possible causes to be evaluated. The doctor may ask questions about daily activities, review medications, perform a physical examination, order blood tests, and sometimes recommend simple memory assessments. In some cases, brain imaging may also be helpful. An early diagnosis can provide several important benefits. It allows treatment plans to begin sooner when appropriate. It gives families time to plan for the future. It helps identify safety concerns before they become emergencies. It also connects individuals with education, community resources, and support services that may improve quality of life. Just as importantly, it reminds families that they don't have to face these challenges alone. Now let's talk about how loved ones can offer meaningful support. If someone seems forgetful, avoid correcting every small mistake. Instead, speak calmly and give them time to respond. Simple, clear sentences are often easier to follow than long explanations. Keeping a regular daily routine may also reduce confusion. Calendars, written reminders, labeled drawers, and pill organizers can help support independence while reducing frustration. Most importantly, remember that patience matters. The person isn't choosing to forget. They're dealing with changes that may be confusing and frightening for them as well. As we come to the final part of this video, we'll discuss healthy lifestyle habits that support brain health, what research suggests about reducing dementia risk when immediate medical attention is needed, and the most important lessons every family should remember about recognizing these early dementia clues. We've reached the final part of today's video, and before we finish, let's talk about something that gives many people hope. Although no lifestyle habit can guarantee that dementia will be prevented, research suggests that taking care of your overall health may help support brain health and may reduce the risk of cognitive decline for some people. One of the best places to start is regular physical activity. You don't have to run marathons or spend hours in the gym. Even a daily walk, gentle cycling, swimming, or chair exercises, if appropriate for your abilities, can improve blood flow throughout the body, including to the brain. Physical activity also supports heart health, helps control blood pressure, and may improve sleep and mood. Speaking of blood pressure, it's important to remember that what's good for your heart is often good for your brain. High blood pressure, diabetes, high cholesterol, smoking, and obesity can all damage blood vessels over time. Since your brain depends on a healthy blood supply, managing these conditions with the help of your healthcare provider may also support long-term brain health. Nutrition matters as well. A balanced eating pattern that includes vegetables, fruits, whole grains, beans, nuts, fish, and healthy fats may benefit overall health. Limiting highly processed foods, excess sugar, and excessive alcohol can also support healthy aging. You don't have to eat perfectly every day. Small, consistent improvements are often easier to maintain than strict diets that are difficult to follow. Keeping your mind active is another healthy habit. Reading books, learning a new skill, doing puzzles, playing cards, gardening, or even learning to use new technology can help keep your brain engaged. The goal isn't to find one magical activity. It's to continue challenging your mind in enjoyable ways. Social connection is just as important. Many older adults become isolated after retirement, losing a spouse, or moving away from family. Regular conversations, community activities, volunteer work, faith groups, or simply spending time with friends can help support emotional well-being and cognitive health. Sleep also deserves attention. Poor sleep may affect memory, concentration, and overall brain function. If you snore loudly, wake up gasping for air, or feel exhausted despite sleeping through the night, talk with your healthcare provider. Conditions such as sleep apnea are common in older adults and can often be treated. Let's also discuss stress. Long-term stress isn't just emotionally exhausting. It can make concentration and memory more difficult. Simple relaxation techniques such as deep breathing, gentle stretching, prayer, meditation, listening to calming music, or spending time in nature may help reduce stress and improve overall well-being. Now, here's one of the most important messages in today's video. Don't ignore persistent changes. If you or someone you love is experiencing ongoing memory problems, confusion, difficulty with familiar tasks, personality changes, or problems managing everyday activities, don't assume it's just old age. Schedule a medical evaluation. Early assessment can identify treatable conditions, provide a diagnosis when appropriate, and help families plan for the future with greater confidence. It's also important to recognize situations that require immediate medical attention. A sudden change in memory, confusion, difficulty speaking, weakness on one side of the body, severe headache, or trouble walking could be signs of a medical emergency such as a stroke. These symptoms require urgent medical care and should never be ignored. Now let's briefly review the early dementia clues we discussed today, repeatedly asking the same questions. Difficulty managing familiar daily tasks, changes in language and conversation, confusion about time or familiar places, poor judgment and decision-making, social withdrawal, noticeable mood or personality changes, frequently misplacing items and being unable to retrace steps. Remember, having one of these symptoms does not automatically mean someone has dementia. Many other health conditions can cause similar problems, and some are treatable. The key is noticing patterns that persist and interfere with daily life. Healthy aging isn't about being perfect. It's about paying attention to changes, taking care of your body and mind, and seeking help when something doesn't seem right. Early action can provide answers, access to treatment, support for families, and more opportunities to maintain independence for as long as possible. If today's video helped you better understand the early clues of dementia, we'd love to hear from you. How old are you, and which country are you watching from? Which of today's clues surprised you the most? If you've helped a family member through memory changes, your experience may encourage someone else who is facing similar challenges. Thank you for spending your time with us today. We hope this information has left you feeling informed rather than frightened and empowered rather than overwhelmed. Take care of your brain, stay curious, keep learning, and remember that paying attention to small changes today may make a meaningful difference tomorrow.